Good morning, everyone. I'm Bob Ravenscroft, the Vice President for Advancement, here for our March 11th press briefing. And March 11th is kind of an interesting day. It was 1 year ago today that the rapidly spreading SARS-CoV-2 virus was declared a pandemic in the world. And it also marks our 129th press briefing, which is hard to believe. I'm going to take just a few moments before the stats to recap some things. It was actually about 13 to 14 months ago when we held our first expanded meeting and began disseminating information on it. And then it was 1 year to this day when we pulled together what we called our incident command team. And that led to the formation of a 24/7 incident command center that began on March 13th. It was staffed by infection prevention specialists, physicians, clinical and support leaders from across the organization. And again, it started out for some period of time operating 24/7 around the clock. It has morphed, but they still continue to this day, and now through Zoom, as this group touches base to make sure everything is under control as it relates to COVID-19. I'd like to take a moment and just speak to the media here to once again thank you for your coverage to help educate the community during this time. I'd like to thank the community for their in-kind and financial support and everything they did. And certainly like to thank the public that practiced all of the non-pharmaceutical interventions, the interruptions to their daily life, sacrificing so much personal interaction. Our most heartfelt thanks from all of us. You know, through this time, we've seen creativity, ingenuity, and most of all, compassion and dedication from our team as we've gone through the seasons of COVID. And they're not fall, winter, summer, and spring, but, you know, the first season was really all about PPE and the supply chain interruptions, and then it kind of evolved into testing, and educate, followed by a lot of sorrow, heartache, and being pushed to the limits of our infrastructure and, frankly, at some points beyond. And now we're at the stage of final season of vaccinations. Through this all, we have lost 222 people under our care. But thankfully, 1,657 have been admitted and discharged. To date, we've administered over 15,000 doses at Bryan Medical Center and supplied volunteers for every Lincoln Lancaster County Health Department vaccination clinic. I think you can tell we are so incredibly proud of our team here and every Nebraskan that helped us through the process. Most of all, to the local media again, and those that practiced all of the non-pharmaceutical interventions and took them so seriously. Members of the media and those of the public that helped, you indeed saved somebody's life. As we've approached this 1 year anniversary, you may have noticed our efforts have switched a little bit to really focusing on education about the vaccine, specifically to underserved populations, or maybe those that are uncertain about the efficacy or the safety of the vaccine. And part of the reason we've really dug in deep on the education is we knew many other organizations would be handling mass media and, broad awareness about the vaccine. And today, the Ad Council of America on the 1 year anniversary launched their campaign, and we just want to pay homage to that and play what you're going to be seeing everywhere right now. So go ahead and roll the tape, Jeff.
Right now, the COVID-19 vaccines are available to millions of Americans, and soon they will be available to everyone.
This vaccine means hope. It will protect you and those you love from this dangerous and deadly disease.
I want to go back to work and I want to be able to move around.
To visit with Michelle's mom, to hug her and see her on her birthday.
You know what I'm really looking forward to is going to opening day in Texas Ranger Stadium with a full stadium.
We've lost enough people and we've suffered enough damage.
In order to get rid of this pandemic, it's important for our fellow citizens to get vaccinated.
I'm getting vaccinated because we want this pandemic to end as soon as possible.
So we urge you to get vaccinated when it's available to you.
So roll up your sleeve and do your part.
This is our shot.
Now it's up to you.
Thanks for rolling that, Jeff. It is up to all of us as individuals now to put a final stake in this thing. So please, when your number's called, strongly consider getting vaccinated. At midnight, we were treating 465 patients here at Bryan. I think the most encouraging thing, right now we have 16 COVID inpatients. 7 of them are no longer infectious, and that means there are only 9 patients, newly diagnosed patients, being treated as inpatients here at Bryan on our 1-year anniversary. That is just a remarkable difference from what it was in November. As you can see from the level of care, of those 16 patients, only 3 of them are in the ICU and 2 of them are currently ventilated. And as we look at by county, and most of it resides here in Lancaster County, but that map looks vastly, vastly different. We did have one advanced question on T-cell testing. I will cover that at the conclusion of Dr. Matt Maslonka's presentation on long haulers. Dr. Maslonka, you may have seen him from some of the public service announcements when things were getting pretty hairy here in the state of Nebraska. He is a native of Fremont, Nebraska, and a physician practicing in Nebraska pulmonary specialties. And he received his MD from the University of Nebraska Medical Center, did his residency at the University of Texas Medical Branch in Galveston, did his pulmonary and critical care fellowship at Wake Forest University in Winston-Salem, North Carolina. And during his fellowship, he became interested in lung cancer with a focus on bronchoscopy for diagnosis and treatment of lung lesions. He remains very active in quality improvement efforts here and continued outpatient management of his recovered patients. He is an advocate for patient education and joint decision-making in all conditions he treats and is passionate about creating strong physician and patient relationships. So with that, it's my great honor to have Dr. Maslonka. You may have seen him on Nebraska Public Television talking about these things and a few other places. He's just been stellar in his approach to help educate the state and the community on all things COVID.
My name is Matt Maslonka. I'm one of the pulmonary and critical care physicians here at Bryan. And as you can imagine, being a lung and ICU provider, this pandemic has specifically affected our specialty in a unique way and pretty significantly. And first, early on in the pandemic, we were treating a lot of hospital patients, a lot of ICU, and even those outside of the ICU that weren't requiring mechanical ventilation, but were requiring high oxygen levels for prolonged periods of time, sometimes even weeks at a time. And thankfully, those days have passed. We're still treating some in the ICU, drastically less numbers. And I think that, even 3 short months ago, our numbers, I believe I saw something yesterday, we peaked at 160 inpatients at Bryan that were COVID positive. And as you early heard, we've got that number down to 20. So that's an incredible journey, and I think a testament to our community's ability to really be dedicated and responsive to some of our pleas for calls to change. And I want to thank everyone out there that made the difficult decisions to stop and slow the spread and to really kind of minimize some of that heartache that was going through those dire times. Fast forward to now, and our practice has changed and transitioned pretty significantly to more of an outpatient type of setting where we're still treating patients in the hospital, but we're seeing more and more come into our pulmonary clinic after they've recovered from their acute illness and having symptoms that have persisted or even new symptoms that aren't related to pulmonary or respiratory issues. And it's that aspect of COVID that I'd like to discuss further and kind of delve into about this condition. So as we know, a vast majority of COVID patients will recover and get back to their baseline without any residual abnormalities of note. But as you've seen in the media lately, there's been an increasing number and testimonies from patients that have had lingering symptoms and things that weren't prevalent or really known early on about this illness. And I think, it's important to discuss this because of the future and how we're going to be having issues with restrictions being limited, and I think more of a transition to personal responsibility and how do we mitigate spread and protect our loved ones and our community members. So these patients that we've been seeing in clinic, some of them refer to themselves as long haulers, and there's a term that has been put out there that's post-COVID syndrome, along with a variety of other terminology and attempts to identify this phenomenon. We've been seeing this in a wide variety of patients, and I think that's important to notice as well, not just the ones that were sick enough to require ICU. Even patients that weren't hospitalized are coming in with these lingering symptoms that I'll go over here in a second. But it is important to keep this in the back of our minds as we kind of navigate the path forward with risk assessment and, again, with our urge to get the vaccine as soon as possible. The most common symptoms of what I'll refer to as post-COVID syndrome include fatigue and is referred to as an overwhelming fatigue. One patient described it to me as it was like he ran a mile all day long without stopping. And another common associated symptom is shortness of breath, and this is particularly with exertion, but can be with even minimal exertion, such as doing activities that we wouldn't really associate with creating enough exertion to cause shortness of breath, like even having conversations or doing household chores around the house, vacuuming, doing dishes, things like that. As well as muscle aches, memory loss, and difficulty concentrating, sometimes described as brain fog, which is a neurologic aspect of the disease. And we have cardiovascular associations with heart poundings, or what we call palpitations, but you really shouldn't have the sensation of your heart beating so fast, which is a very common symptom that we're seeing in these specific patients. And then finally, some cutaneous symptoms such as rash and hair loss. This is all, I think, evidence to point towards that this condition is outside of the lungs. It's not specifically just a respiratory illness, and it's something that we need to further delve into as far as understanding what is happening and what the mechanisms are behind it in order to target directed therapies. And it is something that is very concerning right now for the medical community, and have a lot of researchers that are interested in figuring out the pathophysiology or the actual molecular behind-the-scenes issues that are involved with this. It is being studied at almost every academic medical center right now, and there's different ways in order to help mitigate and treat some of the symptoms that we're seeing that we already have available, and I do want to touch on those. Because when these patients come in, what do we do at that point? There's no known therapeutics or pharmacologic drug therapy that we can do that's been proved and tested. So that's unfortunately not available, but we do have rehabilitation programs. And we already have those in place that were set up to treat typically non-COVID related issues like COPD or heart failure. With pulmonary rehabilitation, I like to describe it as it's physical therapy for the lungs, but they go over breathing techniques and biofeedback mechanisms so that you can mind over matter the anxiety related with what's considered air hunger, that just inability to take in a deep breath, and force yourself to not take shallow breaths, but really belly breathe and take in deep breaths. Things like that. There's also neurologic rehabilitation clinics that were originally set up for post-stroke patients, but all of these programs have been seeing more and more COVID-related patients, and I've anecdotally, personally seen a lot of benefit from folks that have gone and done these programs and get them back to doing things that they were normally able to do in their activities of daily living. So I would like to touch on some exciting news that was just mentioned earlier that I think can relate into the COVID long syndrome, but came out over this past weekend in regards to testing. And some of you might have seen that the FDA on late Friday night just released an emergent authorized use for a different modality than what we've been testing for so far. And this is called the T-cell test. And to give a kind of understanding about what that is and how important that is, I just kind of want to give a bird's eye view of a very simplified version of our immune system. But if you think about our immune system being the defense mechanism of the body, there's really two main components. The first is what we've been kind of focusing on already and was the easiest to test, and that's called the B cells, which are a certain type of cell that circulates in your body looking for foreign organisms or anything that's deemed to be a threat. Once it sees it, it's triggered and produces proteins called antibodies that then are molecules that act as kind of flags or markers that then find that threat, tag it, and bring other cells over to either destroy it or remove it from the body. And so we've done multiple already years worth of studies looking at antibodies, and that's been what we've been doing to see if somebody's had COVID in the past and not an active infection. So we couldn't test the virus that way. There's two limitations with antibody testing. One is that we know COVID or coronavirus doesn't sometimes always cause a robust response in that component of the immune system. It actually sometimes is more in this other one that I'll discuss. But you might have an infection and not produce the amount of antibodies that can be detected. Additionally, there is a certain window of time that is optimized for your test to come back and be accurate. If you're too early or too late, then you might have a false negative. And so we've run into issues where people would have clinical coronavirus or clinical COVID, but their test would be negative. And so this other option that we're having now will drastically improve upon that. And that's the other arm of the immune system, and it's called the T cells. They're like the B cells, as they're looking for any foreign organisms or anything that's deemed as a threat, but you can think of them as like frontline soldiers in a military sense. They are the cells that once they recognize a threat, then they immediately act upon it and try to remove it from the body. Then they create a cascade of other cells that are like them that can recognize the same threat in the future, and those are called memory T cells. And that is the aspect of this that will, I think, produce a lot of benefit with our ability to further and more accurately assess who has been affected and help distinguish those that are having symptoms that's related to COVID, post-COVID syndrome, that have tested negative from an antibody standpoint. So the longevity of those cells will really be a benefit in the future, and it's an exciting aspect of care that I think that is optimism going forward. Lastly here, I just wanted to finally reiterate what I think everyone in the medical community has been saying, and we will continue to say, because it's very important and our best shot at getting back to normalcy. And that is to obtain your vaccine as soon as possible and as quick as you can. To register on your health department, your local health department is the best resource to get that set up. And I just highly advocate everyone that can to get the vaccine. There's many questions out there now that we have 3 available vaccines, which one is the most efficient? And I can tell you that the clear answer is the first one that's available. We know that all 3 of them can decrease substantially the serious complications related to COVID-19, and that's the most important thing. They will be distributed differently based upon resources and the availability of those patients to come back for a second dose, which would maybe prioritize the Johnson & Johnson above others. But the vaccine is our best shot, and we've been playing defense up until this point, up until only a few months ago. And I think that it's been such a blur this past year, but we've had about 9 to 10 months worth of really no dedicated therapeutics that have been a great option, and we've been playing defense with preventative measures like social distancing, masking up, avoiding crowds. This vaccine is our option to go to offense and actually take the fight to the virus. And as an example, and hopefully a show of solidarity and speaks volumes about how we trust the vaccine, I can tell you that every single pulmonary and critical care doctor in this area has received their vaccine, some of them within the first few days that it was able to be received. We join many different specialties across all of healthcare in getting and making this very important decision that is a life-saving decision, and I hope that you join us in this fight and sign up and get it when you're able to.
A little bit more on the T cells, the question that you submitted, Brent. Testing at this point is limited to laboratories designed by a company called Adaptive Biotechnologies Corporation, which includes their lab in Seattle, Washington. And that's the only known lab right now that is running this T cell test that Dr. Maslonka talked about. He talked about a little bit about the different sensitivities and so forth. The results of the assay should always be used in combination with a clinical examination according to our lab, patient medical history, and all of those things. So it's fair to say we're going to continue monitoring this test and its availability at our different reference labs. And it is unlikely that this test would ever be brought in-house at Bryan because of the specific type of test and, sent out to one of the reference labs we use. But it is on our radar, and like so much over the past year, even though I say it's unlikely we'd have it, there is a possibility that that changes, as so many things have through the pandemic.
Honestly, we have been seeing that in reports, and it's not clearly understood why that would be based upon possible hormonal factors or other biological differences there that are playing into it. But I know that that's being researched, especially with other populations that weren't initially studied, like pediatrics and pregnant patients. But I do know about alleviating extreme side effects. If you are able to and don't have any comorbidities that would prevent you from taking a medication like a non-steroidal anti-inflammatory drug, which is ibuprofen or Aleve or naproxen, these are anti-inflammatory medications that will also help with some of the headache and fatigue that people experience. I would also just really be judicious on how you have your time after your second vaccine, because that is the one where your immune system's already been revved up and might have a little bit more side effects than the first one. And so taking extra caution, I guess, as far as your occupational exertion and things like that, and staying very hydrated and avoiding things like alcohol and caffeinated beverages that can dehydrate you is going to be key.
Off the top of my head, what I think you might be seeing is just some of the pent-up demand of other things that were delayed that are now coming back online across the state. That might speak to the hospital capacity. Have you seen anything on this? No. Okay. We are going to look into that a little bit more and go peek at the state dashboard and see, and we'll respond directly to you, Brent. Well, I can tell you that it was in early January, mid-January, our infection prevention staff began following what was going on in China and across the world and began disseminating information. It was then in late February. It wasn't an incident command meeting, but there was a group of us, and it was our emergency preparedness team that meets on different things. And when we came out of that meeting, there was like a aha, like, we're going to have to really, I'll use the term resource this. This means devote a lot of energy, and we knew it was pretty evident of what would come to our country if it got here, and then two, if we didn't do very aggressive things to blunt the spread. You could see that. What were we thinking before the first ever press briefing? I think at that point, we relied very heavily on a CDC-published crisis communication manual that was published under actually the George W. Bush presidency and updated after Katrina under the Obama one, and it kind of prescribed these very specific steps to go through at stages of the pandemic. And one thing that we spoke loud and clear out of these recommendations were it was crucial to have credible, trustworthy voices to speak to the public and to the media. So I guess there was probably an informal pledge at that point for us to be as open and as honest with you for all the good, bad, and indifferent about this campaign, but really begin drawing attention to what our infection prevention team and epidemiologists saw was coming at it, and begin sharing it with the media and the community. So that's probably what was going through our mind right then. It was just step one, to be open, honest, and transparent with you to the ability we could. I think at that time it's safe to say that, boy, when you saw things coming, it's like, how quickly is it coming? And there was some anxiety about that. And we in Nebraska, as you fully well know, had this period of, I think, real diligence early on when things started heating up. And then we kind of waited. And then sure enough, it did come in the fall, and thankfully we were very prepared at that. I'd like to thank Dr. Maslonka here, because when it got really to that tipping point in the fall, I think a big contributing factor was something we weren't really comfortable doing, but there was need for a very direct message to the community, almost a desperate message to say, we need your help. And I feel that's when things really began turning. And we weren't the only one. I know the Med Center and Bryan probably were taking the leads in that type of strong communication, but you saw community after community began implementing mask mandates, and people began seeing, people they knew impacted by that. So these things got serious. So again, we've kind of gone through these different seasons. That's a long-winded answer, and a kind of a non-answer for what were we thinking at the first one. It goes back to, I think we just wanted to be open, honest, and transparent with you, because you could see a long haul. Even at that early time, at that point, we knew that we wouldn't be through this until a vaccination was developed. So everything was trying to mitigate the impact until that happened. Looking back, do you think you fully understand the gravity of about what was to happen? Yeah, I think we do. And certainly we were accused by some of being fearmongers and things like that. But the science and the epidemiology was leading you to the point we all met until vaccinations could become prevalent.
As far as what we were going through at that time, it was very difficult, just because of the vast majority of these patients were very, very ill. And so they came in, and it wasn't like an insidious progression. It was within 12 to 24 hours needing to be intubated, to have a machine breathe for them. And it's always scary when you're still wondering about the data and if you're doing the right thing. And with this being such a novel, new condition, we didn't have those resources like we do with other conditions that have been studied over the years. And so that just added another layer of difficulty with the whole situation. But it thankfully never got to a point where we were exhausted with resources, and I think the community had a great response to that dire need of really, following the CDC's guidelines, and it was a testament that makes you proud to be Nebraskan when you see that happen, because really at the end of November, early December is when we saw that kind of peak start to come down, and it's been a downhill slope ever since. One of the things that hopefully this T-cell test, once it becomes a little bit more robust, will give us extra information, because of the large percentage of patients that are not accurately tested with the antibodies right now. And so without an accurate assessment, we do have patients that have this clinical COVID, but no laboratory or objective data to say that they were 100% positive, but are having similar symptoms. And hopefully with this new test in the future, we'll be able to further delineate that and have a confident number and answer.
It's been a long journey, I guess, is the best way to describe it, Brent. You went from, as Dr. Maslonka talked about, this uncertainty. We were in this waiting period, this preparatory period, and then evidently part of that journey was pushing us to the breaking point and now coming back down off of it. I think if there's anyone tuning into this, when I see pictures from the state basketball tournament and then even the state wrestling tournament a couple of weeks ago, what is probably most concerning is there's sporadic compliance with masking, even though the NSAA has made it very clear of what their expectation of fans are. So all of these things always cause us a little pause. There are the variants out there. Vaccinations are still underway. And boy, you just don't want things to slide back out of control. And I think it even puts Lincoln in a more unique position, because we have people coming in from all over the state. And when they're reluctant to be compliant, sure, they can take some stuff back home to their community, but they could be leaving a lot of it here. So my kind of perspective on it is, there are non-pharmaceutical preventative measures that we all know work. They're the distancing, the masking, and the hand hygiene. So it causes a little bit of angst when you see people not doing it in forums like that. But overall, for those that are being compliant, we're thrilled to be able to see fans cheering on the participants in the state tournament and seeing some life come back into our businesses down in the Haymarket and across the city.
We can do these things and still have fun and get the same experiences that we want our kids to get while still being smart and responsible about keeping up that defense that we have, because until a vast majority of people can get vaccinated, that virus still can go around and cause and wreak havoc. And so that will take some time just as we get through the different phases of those that are higher risk, first off, and then moving down the line for those available for the vaccine. But in the meantime, we still need to be vigilant and keep in the back of our mind some of these things, that these long haul COVID, post-COVID symptoms, and that's some scary things because it's not just your lungs that are affected, and we're talking months and months after their initial infection. And so, no one should have that be on their conscience that they wish they would have made a different choice or a different decision and wouldn't have affected somebody that could have long-lasting complications. So I just highly urge everyone to remain vigilant with the CDC's recommendations and the 3 Cs from the governor's office until we can get a vast majority of people vaccinated.